am 𝙚𝙀𝙪𝙘𝙪𝙘 of Iconic Voice LLC, and guess what? Today's video is about donning your PPE. So guess what? We're going to jump into number 1, choosing the right equipment. Number 2, I'm going to show you how to don it, which means put it on, and doff, taking it off. So over here, you see my lovely supplies. It's already set up. So we're going to pick out what we need. Now, always remember, when it comes to infection control, your facility should have the specific measures to take, right? So depending on the type of isolation and the type of infection, that's going to determine which PPE you're going to wear. So for today, for learning purposes only, we're going to pretend that, hey, let's use the most common virus right now. We're going to use COVID, okay? Now, there's still an argument on whether that is a droplet precaution, or is it a airborne? All right, so again, let's pick out what we need. So here, we gotta have an isolation gown. Boom. So we're gonna take one of those. All right. We need mask. Now this is pretty cool because we have different types of masks. So this is one of the types of N95 masks, right? See? Boop. 2 straps, right? Then you got this N95, which is more of what they call the duckbill. And this also has 2 straps. Okay, somebody's out to get me. They cut my straps. All right, so that's not the best one to show. Hopefully this one's still, okay, great. That one's still attached. All right, for now at least. We have this type. So you have this type of mask. And as you can see how she's wearing it on the box, there are 2 straps. One for the top of the head, the other's behind the neck. And this helps to keep the mask secure. And just to show you another type of mask, we have our all-time classic regular surgical mask. We all know about this one. See? Most common mask, right? All right. So we've got all that. Now there's some other things that we have to remember to add on as well. We have to have face protection. And there's 2 options. You have the face shield, and then you have the wonderful collection of the goggles. Okay, disregard the sunglasses. All right, so for this, we also need gloves. All right. Medium's my size. Always remember to make sure that you're wearing the gloves that fit your size hands, okay? You don't want them too tight. You don't want them too big. Okay, so starting off, the first thing you want to do always is wash your hands. Now you can use hand sanitizer, but me personally, I believe in hand washing more than hand sanitizer. And it also depends on what you're doing. But here we go. You put on the gown, unfold it like so, arms in, boom and boom. Okay. So your gown is the first thing that you put on. Get that on. You get it tied in the back. And there should be 2 ties, one at the waist and one at the neck. And be careful where you're touching your gown too. Make sure you're grabbing the strings or touching the outside of your gown. La, 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 la. Done. All right, so the next thing I'm going to do, I am going to put on my face mask. This is hard to do. Hopefully I don't pop myself in the face, right? Okay. Okay. Now I'm all strapped up. I hope you can still hear me clearly. And the next thing I'm going to put on is my face protection, which is my face shield. Now the face shield has a protective film on it. You want to check both sides. You peel that off. That way you can see, because it's going to get foggy real fast, okay? All right, I'm trying to grip it and get it. There we go. Now, I don't know if you can notice the difference, but it's much clearer now. to see through. All right, I'm all secure. Last thing, I'm gonna apply my glove. Got a glove, and I have my other glove. Ooh. Okay, so now I'm all dressed. I'm all ready to take care of my patient. All right, now that we're all dressed, now it's time to remove the PPE. How do you do so? I'll show you. Okay, so the last thing you put on is the first thing that you take off. So I'm starting with the gloves. And there is a technique that you must do when removing these gloves, okay? So first step, you take the glove, you want to pinch the inside and peel it off your hand. Second step, you stick your finger under the glove, making sure not to touch the outside. Then ta-da! Whoop! Toss it. Well, not like that, but you know, I could do that because it's a video. You would toss that in the garbage. Okay, next thing, you want to remove the face shield. Okay, you only grab the straps. Grab the straps and it's off. Woo, it's hot, baby. All right, then you want to remove your mask. Now, when removing the mask, you're also careful to only grab the straps, and I do recommend starting from the bottom. Okay, that's 1 and 2. Woo, woo, ah, okay. And you would not touch your hair. So, okay. So now we are going to take off the gown. And this too requires a specific or special technique. So the first step is to untie the tie. Now you can either 1, pull the tie to untie it, or 2, you can just snatch it and break the tie. Okay, so you're snatching the gown. But listen, when you're removing the gown, you do not touch the outside. Always remember that it's contaminated. It might sound a little disgusting, but I always think about one, either I'm contaminated by poop or a virus, and neither one do I want on my hands or do I want to take home with me, okay? And I don't want to smell poop, right? Ugh. Okay, not on your hands at least. I know we do in nursing, but anywho, let's stay focused. Okay, so you're removing the ties in the back. So you pull it, it's a loose or it's loosened, and then you grab the other. It's torn. That's okay. That goes in the garbage. All right. Then you want to try to get the gown off of you by putting your hands under the gown. And then you push it off of you. All right. You don't want anything from that gown. And if you notice, I'm grabbing the inside. I know this side is clean. So I'm pulling the gown off and then boom, it's inside out. I can roll it up and I can throw it away. So that is how you don and doff PPE. So always remember, follow what your instructor tells you. But if you ever forget, you can always refer back to my video. But your instructor or your facility manager, whatever or whomever is directing you to learn this procedure, make sure you listen to them and follow their rules. But also make sure that you know what you're talking about and you're protecting yourself so that you can care for your patients properly. Thank you for joining me.